Okay,
You can have that.
so, thank you, John. So the biomarker is, again, just think about it as something you measure in the human body, usually urine or blood. And it can be, however, not just the chemical itself or the metabolite of the chemical, as in the case of pH, as your body kind of breaks it down and then excretes it. But it can also be the effect of that exposure on part of the cell as well. And we'll talk a little bit about those, because those really help with presumptive cancer cases as well, and help with IR. So John had mentioned, why are we having this for so long? Well, depending upon the type of cancer, it can take many years between the exposure and the onset of cancer. So it can be as short as 3 years for some forms of leukemia. It can be well beyond 30 years for some forms of lung cancer, particularly those due to asbestos exposure, which you're going to get if you're not wearing your SCBA during overhaul, because we know that there's asbestos there. That's work we did with Phoenix Fire 20 years ago, something like that, a long time ago. So John really didn't like the slides I had, so he fixed this one up, and so hopefully it's firefighter friendly. But think about that. When we started this, there wasn't good evidence that firefighters' exposures directly damage their DNA. We actually have that now. We're not the only group. There's groups around the country and around the world that do really good research of firefighters. So we now know that it directly damages DNA as well. But there was another way that you can cause cancer through exposures by changing the gene expression. You don't change the DNA itself, but you change the expression of the genes. And that's controlled by DNA methylation and microRNA. But think of those things like light switches. So you take something that's an oncogene. If it's not switched on, you're okay. But as soon as you flip that oncogene on, like light switch, now all of a sudden it's promoting your cancer. Same thing, tumor suppressor. If it's switched on, you're good. If an exposure comes along and turns it off, that's going to increase your risk of cancer. So that's essentially what we're finding is happening in firefighters. So it's a way that your exposures can lead to an increased risk of cancer. And we know what these markers mean in the general population.